Hi Lacey, my name's Kacey. I'm gonna be your nurse today, okay?
Okay.
So is anything going on?
No.
Okay, so is this an annual checkup for you? Okay, good deal. So you haven't been experiencing any pain anywhere, nothing of that sort? Okay, good deal. I'm gonna ask you some questions about your health history and some other things, okay?
Okay.
Do you have any medical problems that you're aware of?
Just IBS.
Okay, when were you diagnosed with that?
2011.
Alright. No other health problems? Okay, as far as surgeries, what have you had before?
Tonsils and adenoids removed in 2012.
Okay, good deal. Do you take any medications daily?
Generous for birth control.
Alright. Are you allergic to anything?
Not that I know of.
Okay. Alright, do you drink?
No.
Okay, smoke?
No.
Okay, any recreational drugs?
No.
Okay. Have you been pregnant before?
Yes.
Okay, is your child living?
Yes.
Is that your only pregnancy that you've had? Okay, good. Did you have a C-section or natural?
Natural.
Okay, good. No complications with delivery, anything of that sort? Alright. As far as your annual screenings, pap smear, breast exams, are those all up to date?
Yes.
Okay, good. Have you had your flu shot this year?
Yes.
Okay, and you're up to date on your tetanus?
Yeah.
Okay. When was the last date of your menstrual cycle?
2 weeks ago.
Okay, so there's no chance right now that you could be pregnant?
No.
Alright. Can you tell me your name and your birthday?
Lacey Lemoyne, 7/24/92.
Okay, what city are we in?
Echo.
Okay, who's the president right now?
Barack Obama.
Okay, so we can tell from so far in her assessment that her level of consciousness is awake, alert, oriented ×4. Her skin color is appropriate to ethnicity. No cyanosis, no erythema noted. Her posture is appropriate. Her gait and mobility, when she came in, it was even, it was smooth movement. She didn't have any shuffling. Her shoulders and hips were symmetrical in movement. She was full weight bearing. Her expression, her mood, her affect are all appropriate. Her speech is clear, it's not slurred, it's at appropriate rate. Her hygiene is also appropriate for today. Alright, so before you got in here, we did your vital signs. Everything looked very great. Your blood pressure was 120/72, pulse was 70, respirations were even and unlabored at 16, and then your temp was 98.2 orally. Okay, so those are all within normal limits. Can I ask how old you are?
22.
Okay, and how tall are you?
5'6".
Alright, good deal. Alright, so now we're going to start the exam, okay? So I'm going to test your cranial nerves first.
Okay.
I'm just going to give you some simple directions to smell things and look at certain things. Nothing should be discomforting to you, okay? If it is, then just let me know and we'll stop, okay? Alright, so our first one, we're going to test her olfactory nerve. That's going to be her sense of smell, cranial nerve 1. So Lacey, I'm going to get you to smell something that will be pleasant, it won't be horrible, okay? So I'm going to get you to close your eyes and just put your finger over one of your nostrils, okay? Okay, smell.
Okay.
What was that smell?
Like strawberry.
Yeah. Alright, now close the other and do the same. Okay.
Vanilla.
Alright, good. So her olfactory nerve is intact. Now we're going to move to her optic nerve, which is cranial nerve 2. Alright, Lacey, I'm going to get you to stand up for me and just stand right here. Alright, we're going to get her to look at the Snellen chart. So can you cover your left eye for me? Okay, good. Can you read this line for me where my finger's at?
VRNHZDCSKO.
Okay, now cover your right eye and do the same.
VRNHZDCSKO.
Alright, now leave both eyes uncovered and say the line again.
VRNHZDCSKO.
Alright, so she has 20/20 vision. You can go ahead and take a seat back down. So she has 20/20 vision, so her optic nerve is intact as far as that goes. Now we're going to test Perla on Lacey. I'm going to shine this light in your eyes, okay? I'm just going to see how your pupils react to it. Okay, so her pupils are equally round and reactive to light. And now we're going to test accommodation. Okay, so I want you to look at this pen. It's going to go towards your nose, okay? Just follow. Good. Alright, so her optic nerve is intact. Now we're going to move to the oculomotor, trochlear, and abducens nerve, which is nerves 3, 4, and 6 with the cardinal field to gaze. So I want you just to watch my pen, okay? Keep your head straight and just use your eyes. Very good. So those cranial nerves are intact as well. So now we're going to go to the trigeminal and we're going to check her jaw movements, okay? So can you clench your jaw for me? Okay, can you put your jaw forward and open? Alright, good. Any tenderness, pain with that? Alright, awesome. So now we're going to go to the facial nerve and I'm going to get her to make some facial movements for me. Can you smile? Raise your eyebrows and make a scared face or happy, sad. Just some expression. Good deal. Alright, so now we're going to test cranial nerve 8, which is our acoustic nerve, which tests her hearing. Alright, Lacey, I'm going to do a little snap. I need you to tell me which side it's on, okay?
Okay. Left. Right. Left. Right.
Okay, good. So her acoustic nerve is intact. Now we're going to test her glossopharyngeal and her vagus nerve by looking at her uvula at the rise and fall of that, okay? So I'm going to need you to open your mouth and stick out your tongue. Is that, yeah, good, good. So her uvula did rise and fall, so those cranial nerves of 9 and 10 are intact. Now we're going to assess cranial nerve 11, which is her spinal accessory. So can you raise your shoulders for me and move your neck around? Okay, now push up against my hands. Good. So she has appropriate muscle strength with that as well, about a 5 out of 5. Now we're going to test the last cranial nerve, and that's number 12, and that's the hypoglossal nerve. And so we're just going to get her to stick out her tongue and wiggle it from side to side. Good. The tongue is symmetrical in movement. She was able to go to both sides, so all her nerves are intact. Alright, so now we're going to go to her skin. Like I said earlier, her skin color is appropriate to ethnicity. It's dry and warm. Her skin turgor is elastic. It goes back very quickly. No signs of dehydration. No lesions noted. Have you had any weird spots on your skin that you know? Okay. And no bony prominences where they should not be. Okay. So now we're going to move to her head and we're going to look at her cranium and her skull. No deformities noted. Her hair is spread equally throughout. No flaking, no lesions on the head noted. Now we're going to check her sinuses. I'm going to get you to turn a little bit towards me, Lacey, in an angle. Okay. So I'm going to feel your frontal sinuses, okay, and your maxillary. Okay, are those tender at all? Okay, good deal. Now we're going to feel your TMJ, so I'm just going to hold you at the joint right there. Can you open and close your mouth? Okay, no popping, no abnormal feelings felt right there. Any tenderness? No tenderness noted. So her TMJ is appropriate. So now we're going to go to her lymph nodes. We're going to go to the preocular, right here, postocular, occipital, submandibular, submental, and then cervical. Was any of that tender to you? Okay, so no tender, so no palpable nodes noted. Now we're going to go to her trachea. Okay, her trachea is intact and it is in line. I'm going to feel her carotid pulses. Alright, both carotid pulses are 2+, as well as the rhythm is regular. Alright, so next we're going to look at her eyes, her nose, ears, mouth, and throat. But before we do that, let's look at her neck veins. That's one thing I need to add to that. Alright, so I don't see any JBD present, no abnormalities as well on either side. Alright, so now we're going to move to her mouth, throat, nose, eyes, ears. Alright, so her eyes, the external structures are symmetrical. Her conjunctiva is pink, no signs of any irritation, discharge, drainage. Her sclera are white, no signs of yellowing or any abnormalities. Now we're going to move to her ears. Do you feel, we'll pull up and back for adult. Do you feel any tenderness or anything? Okay. No lesions noted as well with the ears. We'll check this one too. And the same for this one too? Okay. Okay. So now we're going to check out her nose. The external structures look fine, no swelling, again no lesions, nothing abnormal. And then we checked her patency when we did the smell test with her olfactory nerve. We could see that both nostrils are patent. Her lips are pink. Can you show me your teeth and your gums? Okay, teeth are aligned, no sign of any cavities. Her gums are pink, and her buccal mucosa is pink and moist. We could tell that when we checked her cranial nerves with a uvula. Alright, so now we are going to move to the lungs in the respiratory assessment. So as we can see, her thoracic cage expansion is 2 1 in diameter. So that's appropriate. Her respirations are even and long labored. Her chest rise and fall is symmetrical. Do you have any lumps or tenderness on your chest or your back that you know of? Okay. So now we're going to auscultate her lung sounds. So I'm just going to put this on your chest and just listen, okay? Now I'm just going to get you to turn to the side a little bit so I can listen to your back. Alright, so her lung sounds are clear in all 4 lobes, anterior and posteriorly. Now I'm just going to feel her spinous process, go down each vertebrae with my thumb and just feel for any abnormalities or any tenderness, so let me know, okay? If you're tender anywhere. Okay. So, no tenderness, no lateral deviations, or curvature, any of that noted going down her spinous process. Now we're going to move to her heart. I'm going to auscultate the 5 areas. We're going to start with aortic. Which is the second right intercostal space. Then we're going to go to the pulmonic, which is the left intercostal space.
No.
Then we'll go to Erb's point, which is the third intercostal space. The tricuspid, which is the 4th intercostal space. And the mitral, which is the 5th intercostal space, mid-clavicular line. And then around in that area will be the apical pulse as well, and we're going to listen to that for 1 full minute. So after 1 full minute, her apical pulse is at 72. And the rate was appropriate and regular. So, alrighty. Next, we're going to go to her abdomen. So, I'm going to get Lacey to lay down for me a little bit. Okay. So, at this time, I would look at the contour of her abdomen. It's flat, it's not distended, no masses noted. I would then look at her skin for any scars, lesions, any petechiae, things of that matter. Then I would look for pulsations in her abdomen and then around her umbilicus for any evidence of anything like a hernia. So then the next I would listen to the bowel sounds. Go from right upper quadrant. And you can listen to 2 minutes at least. So after listening to 2 minutes to her right upper quadrant, the bowel sounds are normal. We'll move to the left upper quadrant. And after 2 minutes, they are normal as well. We'll move to the left lower quadrant. And the right lower quadrant. And after 2 minutes, those bowel sounds are also normal. So her abdominal sounds, they sound great. They're not hypo or hyperactive. Then we're going to move to light and deep palpation. So I'm just going to lightly palpate each area of the abdomen for any tenderness, masses, anything that might be on the surface that I can't see as well. Then we'll move to deep palpation. This is used to find any masses that may be deeper in the abdomen and any tenderness there. So we'll use both hands for that, and we'll palpate all 4. Alright, so her abdominal assessment was good. Everything was appropriate within normal limits. No tenderness, no deformities, and no lesions, nothing of that sort noted. Alright, so Lacey, we're going to move down to your lower extremities, okay?
Okay.
What I'm going to do, I'm just going to roll up her pants leg a little bit. I'm just assessing both. I'm going to start with the skin color. It's appropriate for ethnicity. No discoloration noted. No edema noted. I would also assess her cap refill, which is brisk, on both feet. I'm going to feel her dorsalis pedis pulses. And they're 2+ regular rate and rhythm. I'm going to feel her posterior tibialis pulses. And they are the regular rate and rhythm. Now feel her populus heel. And those are of regular rate and rhythm. Next, I'm going to feel her joints for any tenderness, any swelling. Do you have any tenderness, any pain in your joints? Okay. And what's your occupation again?
Nurse.
Okay, so you haven't been having any back pain, leg pain, anything? Because we know that's a lot of being on your feet. So, no deformities noted. The size is appropriate for all of her joints. Now we're going to test her bilateral leg muscle strength. Alright, so can you push down on my hands? Okay, now pull back. Good. I'm going to get you to push your leg up against my hand. Good. Now push down. Good. Same for this side. Okay. Okay. Can you bend your knee for me? Okay. And your other knee? Alright, good deal. So now we're also going to look at her range of motion. We saw that she was able to move her knees, her legs up and down, but we're going to look at her feet now. She was able to flex her feet and dorsiflex, so we're going to look if she can do inversion as well. So can you point this foot inward, and now point it outward, and the same for this one, inward and outward. So good. So her legs, as far as the extremities with range of motion, the muscle tone, edema, all of that checked out fine. So I want you to stand back up, Lacey. I mean, sit down. Alright, now I'm going to test your deep tendon reflexes, okay? Okay. Good, so both of those deep tendon reflexes on her knees were reactive. Now we're going to look at both arms. Again, repeat all of these same steps. So I'm going to look. Her cap refill is less than 3 seconds. Her no lesions. Skin tone is normal for ethnicity. We're going to palpate her joints. Any pain?
No.
They're appropriate for size. Okay, now I'm going to feel her radial pulses. They're 2+ regular rate and rhythm. And feel her brachial pulses. So they are 2+ regular rate and rhythm. I'm going to look at her cap refill on this and as well, and then palpate her joints. Okay, so no shoulder pain, no back pain as well. Alright, good. No edema is noted to her upper extremities either. Now we're going to test her range of motion and her strength. So can you move your wrist around for me? Good. Can you pull them up and pull them down? Spread out your fingers. Okay, and we'll do that on the same one. Okay, and then move your wrist. Okay, good deal. Now with your elbow, can you pull up? Okay, now. Yeah. Pull straight. Alright, good deal. Can you stick both hands out and then, okay, are you having any trouble doing any of this?
No.
Okay, good deal. Now I want you to squeeze my fingers with both of your hands. Okay, so strength is 5 out of 5. We're going to do this arm now. Can you pull towards you? Okay, now push towards me. Good. And we'll try this side too. Pull towards you and push towards me. Good. Alrighty. Now the last area I like to look at as far as range of motion and muscle strength is her shoulders and her back. So I'm going to get you just to stand up for me, Lacey. Okay. Can you pull your shoulder across your chest, each one? Okay. Can you raise both arms up? Good. And put them back down? Good. And put one arm across your shoulder. Okay. And the next one? Okay. Now we're going to look at your back. Are you able to bend forward? Okay, good deal. One last thing. I just need to test your sensation, and then we'll be done. And then we'll let the doc come in, okay? So you can sit back down for me. I'm going to you to close your eyes. Alright, I'm going to touch an extremity. You just tell me where I'm touching, okay?